much as possible. Councillor Cleaver, please.
Thank you, Mr. Chairman. In relation to the ICB report, I noticed that the section on the quality of GP service provision is quite short and only mentions the current situation with the 2 GP practices which are currently rated as inadequate. There's no mention of the GP practices in Lincolnshire which are rated as requires improvement. And there's no reference to what's happened recently in the last 12 months, for example, with the any change in the numbers that are rated as inadequate, any change in the numbers that are rated as it requires improvement, which is disappointing. There's also, of course, no comparison with comparable figures nationally. So I've had a quick look on the CQC website, and I was quite surprised. So we have, if I'm correct, 2 GP practices at the moment rated as inadequate, 6 more rated as requires improvement out of 81. Now that means that we have 10% of our GP practices in the county rated as requires improvement or inadequate, and that compares with only 5% nationally. The other thing that I was quite surprised to see was that these tend to be the larger practices. So therefore, those 8 practices represent 14.2% of the patient population, which equates to 116,723 patients. So we have 116,000 patients in Lincolnshire who are registered at a GP service, which is either requires improvement or inadequate. And in that context, I'm disappointed that those points aren't made in the report, and I would welcome your comments on the statistics that I've just quoted to you. Thank you.
Thank you, Councillor Cleaver, and apologies for the lack of detail in the report. Certainly something we can provide in future. I think following the last committee meeting, we did provide a little bit of breakdown on CQC ratings, but happy to provide more detail in future. In terms of CQC ratings, the ICB's quality team and primary care teams work very hard with practices to support them in addressing some of the issues that are raised by the CQC. I think one of the interesting things for us is we've seen a change in the CQC inspection regime recently, and we're working to support practices to understand what that means for them and some of the things they may need to address that are different now compared to previously. We've got a range of support that we offer. We go in and provide visits into practices, and we provide some tools to allow them to understand how the CQC might view them, so IT tools that will do similar searches to the ones the CQC do. So we're providing a lot of support to practices, working hard to work with practices so they can improve their CQC rating. I think in terms of the statistics, they sound accurate to me. I haven't got any comment to make about that. I think the important thing really is that we work together with the practices to try and support those improvements where they're required.
Thank you for that. I'm obviously aware from previous correspondence that you are very conscious of the fact that you need to work with practices and that you do identify those who are having difficulties and you support them. My concern is where I'm looking for some reassurance is that given that of the 4 reports published so far this year, so we're 4.5 months into the year, 3 will require improvement, only 1 was good. And I'm just concerned that we have a slow drip effect of this number going up. And I think I'm looking for some reassurance that the measures that you're already taking are going to be adequate to actually nip that in the bud. If that, yeah, thank you.
Yeah, thank you. As I mentioned, I think there's something around the new inspection regime. I'm not saying that's entirely the issue here, but it's about about us understanding that and supporting practices. But I think we're providing additional support into practices, and we've got a currently a programme of work where we're working with practices, particularly one where we feel that they may benefit from some support, but we're working through a programme of support with them, so doing kind of quite in-depth kind of diagnostics with the practices, identifying areas for improvement, and then working with the practices to support them with that. I think we've had some pretty good feedback around that so far, and we saw around 20 practices last year. We'll be looking to deliver that support framework to as many practices as we can. We're hoping to cover the rest of the practice over the course of the year. Some of them, I think we had one outstanding report over the last 12 months actually for Bourne-Galletley, so that was positive. So some of those practices we might not prioritise because they're already doing well and got a good rating with the CQC. But I think the work we're doing will support practices, and I think we'll start to see improvements in those ratings. But I think it is partly down to that change in CQC inspection regime. Again, I'm happy to provide much more detail on that in the future report if that would help.
Thanks for your question. Just to build on what Nick just said there, I think clearly no practice wants to have a CQC report that's less than ideal for them, and patients don't want that either. Understandably, they want the reassurance and the safety net that the practice is operating in a safe and effective manner. We should all aspire to that. I think, sadly, it's clearly a reflection of the pressures that we talked about earlier, and that if we were working in a GP practice scenario anywhere in the country, but obviously in Lincolnshire, if we had great estates, we were fully staffed, we were well resourced, you would hope, and we would definitely aspire to be having a different set of outcomes. So I think it's a bit of a temperature check on what's happening in terms of the pressures for practices, because an awful lot of work is going in from the ITB. At the LMC, we do an awful lot of work with practices around CQC. What I would say, particularly around CQC, is it is an incredibly complex process for practices. There are so many facets to it. It changes, and obviously the new inspection process, so practices are having to try and adapt to that as well, while of course trying to do all the normal day-to-day things as well. And that's particularly pressured if you are then short of a practice manager or an ops manager or the GP who leads on this example. So we should all aspire to have really good reports, of course, from CQC. It's good for our patients, and actually it's a positive feedback loop for us within practices. But I think, unfortunately, it is partially a reflection on the environment that we're working in currently. And it's particularly difficult if you are then working within a wider system where acute trusts are struggling or the ambulance services are struggling, etc., because we're all part of one big system, aren't we? And we all have a knock-on effect on the others.
Just one thing to pick up on then. The fact that there is a higher proportion of GP practices in Lincolnshire that are rated as requires improvement or inadequate compared to nationally. Would you care to comment on that? Do you think there's any factors that we should be aware of in that?
Thanks. Sarah Jane and Nick may also come in. I think part of it will at least go back to some of the pressures that make Lincolnshire, unique compared to some other areas nationally. Okay, so if we're thinking about that national figure, part of it will be about the inspection processes, because they vary a little bit. The part of it will be about the system that those practices are working within, and clearly for Lincolnshire, our infrastructure and our geography actually have an effect on the service that we can provide. So clearly that has, as we've already talked about, an effect on workforce recruitment and retention, which is going to have a direct impact on the report findings. If there is an adverse event that happens within a GP practice, that might be partly something that's happened within the practice, but it also might be directly linked to one of our colleagues at one of our trusts, or be that the acute trust or EMAS or anyone like that. So because we are all directly linked and all of our individual organisations are challenged, that might be part of the explanation as to why we have a different percentage to other areas of the country.
Can I just so I think readers alluded to, obviously Lincolnshire has got very different communities, very different demographics, and if you look at the variation and some of the pressures, they are inextricably linked to some of the challenges, particularly in the rural and coastal communities, and the infrastructure to support patients in those areas. I think it's also just to try and provide a balance, because we are never complacent about the fact that we've got practices that are both either requires improvement or inadequate. And as Nick has talked about, we are consistently supporting them. But the counter is we actually have 90% of our practices who are delivering really good care. And I think, you know, we should never be complacent, and we should always work with the practices and recognise the challenges in those the communities. But I do think it is important to also acknowledge that we have got some really good practice service delivery for patients across the county. And from an ICB perspective, it's really understanding what's, if you like, beneath that variation. And that's where the GP strategy is going to be really important, because my hypothesis is that there will be elements that are about the integration with other services, the facilities in those different communities. I was with a practice yesterday, and they were describing how people living in their community will wait, even though they have a clinical need, and they can access support over the weekend. They will wait because they don't want to travel 20, 30 miles to a service. So we've got all those complexities that, as part of our GP strategy, we will need to look at and consider how we support general practice in those areas.